Hi, Dr. Keener. This is my slideshow that I'm going to show you. It is the nurses that I worked with to do my practicum for simulation practice within the community care clinic. So we focused on IVs, wound care, and filament testing for primary prevention diabetes. So we're starting with IV insertion. So I set up a low validity mannequin arm in the clinic for the nurses to practice insertion of IVs. So here I have some of the nurses working alongside me with the insertion of IVs, how to do it. So based off of the scenario that I provided, I helped some of the nurses along as well. They took the scenario and worked alongside a low validity mannequin for IV. We also used this for the workshop that I did with one of the stakeholders. So here she is here. Here's another nurse doing it. So some of the nurses did the IV clinic with me a few times until they built their confidence, and some were able to do it on an actual patient. And I actually got the patient's permission to just take pictures of the nurse doing it in their arm, which was successful. As you can see here, one of the nurses are working with the patient to do the IV. Here is the workshop that Samantha and I created. We had a good turnout. We had about 9 nurses, and we also, to the left, the picture to the left is an actual employee, a nurse that allowed the nurses to actually do an IV insertion into his arm, which was great. We moved to wound care. I had set up a foot that has different staging. The nurse, based off of the scenario, I provided a scenario. They picked one wound. They were able to tell me what stage that wound was in, and I gave basic dressings. So they were to choose extra dressings or extra applications for that wound in according to the stage of the wound. And according to a lot of the referrals that came in were very vague from the physician. So my scenario helped that, and whatever stage wound they chose on the foot, they were able to dress it accordingly. So the goal of this was to reduce the number of reoccurring patient that came in with the same wound that wasn't healing properly. So once we were able to identify the stage and apply the right application and dressing, we were able to reduce the number of visits for that patient. Because they did work with Ontario Health at Home, and in Canada, Ontario Health at Home only allows a certain amount of visits for a certain period of time, and then the patients will have to go to private, where they have to eventually pay out of pocket. So here's one of the nurses working on the wound. So she chose a wound with sloth, and you can see Idazorb there to break up the sloth. So that was very, excuse me, that was very successful for her. And then again, here's the same nurse. She's working on an actual patient's foot that is a diabetic wound there. Again, with the patient's permission, I took his foot. And here's a different nurse, also with a diabetic foot, with a different patient. And here's Anadine that she used on this foot because there was drainage. Filament testing. So I set up a scenario for filament testing, and we used the same mannequin's foot. And she was able to do the sequence of filament testing. Because I am an advanced diabetic foot care nurse, filament testing is a must. So I was able to educate the nurses on that and how to actually do filament testing and have the patient close their eyes and locate where the actual filament is on their foot to determine if there is a neuropathy in that area or not. So these are some of the nurses working, me also showing them. Again, filament testing with a different nurse. And then here, another nurse doing filament testing on a patient's actual foot. So pre and post survey, this is the results. I included this also in my manuscript. And this is for wound care. And this is for filament testing. And the conclusion to my clinic. Thank you, Dr. Keener, for taking the time to watch.